Subscribe to my channel to learn about health-related knowledge. What I will talk about today is: what are the hazards of uterine fibroids, how to treat. Uterine fibroids are common benign gynecological tumors. Women of childbearing age between 30 to 50 years old are most likely to suffer from uterine fibroids. Although it is a benign tumor, it still brings many harms to our women's health. So, what are the hazards of uterine fibroids? How should it be treated? 1. Anemia. Uterine fibroids can lead to increased menstruation and prolonged menstrual periods. This will cause secondary anemia for a long time. In severe cases, they may even appear pale, weak, or short of breath, affecting the health of the patient. 2. Infertility, miscarriage. Large uterine fibroids deform the uterine cavity, and the uterine fibroids at the horns of the uterus compress the entrance of the fallopian tube, which will affect the implantation of the fertilized egg and eventually cause infertility. Some are prone to abortion even if they are pregnant. 3. Pain. Under normal circumstances, uterine fibroids do not cause pain, but some patients will experience symptoms such as lower abdomen swelling and backache. In addition, red degeneration of uterine fibroids and torsion of subserosal uterine fibroids can cause acute abdominal pain. 4. Uterine bleeding. Many patients with submucosal uterine fibroids and intramural uterine fibroids will have uterine bleeding. Among them, periodic bleeding is more common, mainly manifested as increased menstrual flow and prolonged menstrual periods. So, how to treat after uterine fibroids are detected? The current treatment methods for uterine fibroids mainly include expectant observation, drug treatment, and surgical treatment. 1. Look forward to the observation. Expected observation is mainly suitable for uterus less than 12 weeks gestation size and asymptomatic, especially near menopausal women. Regular follow-up observations should be made to pay attention to whether symptoms appear and whether fibroids are enlarged. 2. Medication. At present, there is no medicine that can eliminate fibroids. Some medicines will temporarily shrink fibroids during medication, but they will often continue to grow when the medication is stopped. Therefore, drugs are generally not used as a conventional treatment for uterine fibroids. 3. Surgical treatment. Surgery is currently the main treatment method for uterine fibroids. The uterine fibroids are large in size or cause compression symptoms such as the bladder and rectum. Causes increased menstrual flow and secondary anemia. Conditions that affect pregnancy usually require surgery. There are many surgical methods for the treatment of uterine fibroids, such as focused ultrasound ablation, laparoscopic myomectomy, hysteroscopic myomectomy, vaginal myomectomy, open myomectomy, uterine artery embolization, hysterectomy, etc. In the process of treating uterine fibroids, the clinician will make comprehensive analysis and recommendations according to the specific conditions after the examination, so don't worry too much about uterine fibroids, just choose the appropriate treatment based on your own situation.